Have you ever felt a little lost or overwhelmed when dealing with your health? It's completely normal. From preparing for a doctor's visit to trying to remember everything you were told afterwards, it can be a lot to handle. What if you had a helpful assistant to make it all a bit easier? That's where AI, or artificial intelligence, is starting to make a real difference. And I want to talk about how we at BlueCap AI are helping people use it safely and effectively. First, let's clear something up. When people hear AI in healthcare, they sometimes picture a robot replacing their doctor. That is only science fiction, not reality. The truth is, AI is a tool, like a calculator or a search engine, but much smarter. It's designed to help us process information, stay organized, and communicate more clearly. It is absolutely not there to replace the expertise, empathy, and critical judgment of our doctors, nurses, and physiotherapists. The human connection is, and always will be, at the heart of good healthcare. So, how can this tool actually help? AI can support you by helping you prepare for appointments, reflect on your progress, and stay organized on your health journey. It's about empowering you to be a more active participant in your own care. Let me give you a real-world example from one of our early test cases. Meet Debbie. Debbie recently had knee surgery, and her recovery journey involved regular physiotherapy. She started using her BlueCap AI assistant to help manage her recovery. After each session, she'd log her exercises, how she felt, and any new instructions from her physio. The AI helped her track her progress day by day, creating simple charts that showed her improvements over time. This wasn't just motivating, it was incredibly useful. Debbie is also a keen cyclist, and she was anxious to get back on her bike safely. She used her AI assistant to research and plan flat cycling routes near her home, carefully avoiding steep hills that would put too much strain on her knee. Before her next physiotherapy appointment, she asked the AI to create a one-page summary of her week, her daily pain levels, the exercises she completed, and the short, safe bike rides she took. When she went to see her physiotherapist, she didn't have to rely on memory alone. She had this clear, concise summary ready to share. This allowed her physio to get a much better picture of her week-to-week recovery, leading to a more productive conversation and a tailored plan for the next stage of her rehabilitation. The key thing here is that all the medical decisions and treatment advice came directly from her physiotherapist. The AI was simply the tool that helped Debbie organize her information and communicate it effectively. It supported the relationship with her healthcare provider. It didn't interfere with it. This isn't just a one-off story. We've been running community drop-in sessions, teaching people how to use these tools, and the results have been fascinating. For instance, if you have a nagging pain and you're not sure how to describe it, you could ask an AI assistant, "What are some good ways to describe joint pain to a doctor?" The AI might prompt you to think about when the pain is worse or what makes it better, or may walk you through some simple movements to help you better understand your pain. By doing this research beforehand, people walk into their appointments feeling more prepared and confident. They're able to ask clearer, more specific questions, which helps their doctor understand the issue much faster. It transforms the appointment from a place of anxiety to a proactive conversation. And what happens after the appointment? We've all been there. You leave the clinic, and your head is spinning. You were just given a new diagnosis, a prescription, and a list of instructions. It's easy to forget the details. This is another area where AI is proving to be incredibly helpful. People in our sessions are learning to use AI to better understand the information they have been given. For example, you could ask the AI to explain a medical term in simple language. Or you could input the instructions for a new medication and ask it to create a simple daily schedule for you. You might ask, "Can you explain the difference between these two treatment options my doctor mentioned?" Again, the AI isn't making the decision for you. It's simply breaking down the complex information you've already received from a medical professional, making it easier for you to digest and remember. This all comes down to a few key benefits. Using AI as a personal health assistant helps people ask better questions. It helps them remember what was said. It makes them feel less overwhelmed by information. And crucially, it keeps them engaged and involved in their own care. When you feel like you have a handle on things, you're more likely to follow your treatment plan and have better outcomes. It's vital to reinforce this point. This is all about supporting, understanding, and communication. It is never about diagnosis or medical decision-making. Your doctor is your trusted source for that. Think of AI as your personal medical secretary, not your doctor. It organizes your notes, looks up terms you don't understand, and reminds you of your schedule. At BlueCap AI, our entire mission is built around introducing this technology safely and responsibly. We believe the best way to do that is through hands-on, in-person support. That's why our community drop-in sessions are so important. We sit with people, answer their questions, and guide them step by step, ensuring they feel comfortable and confident. We're not just giving people technology. We're giving them the skills and the confidence to use it for their benefit. In the end, the future of AI in healthcare isn't about replacing the human touch. It's about enhancing it. The best technology is the kind that helps us connect better with each other. When an AI tool can help a patient like Debbie have a more meaningful conversation with her physiotherapist, or help someone feel more prepared for a crucial doctor's appointment, then it's doing its job. It's strengthening the most important relationship in all of healthcare, the one between you and the people who care for you. AI works best when it empowers people and strengthens human relationships, not when it tries to replace them. That's the future we're working to build. Thanks so much for watching, and if you found this interesting, please consider subscribing for more insights on how technology can safely support our lives.